back. Your Eye on Health is live tonight, and we are looking at a different way to treat PTSD. We often hear about therapy or medications, of course, to help with the condition. But Dr. Mark Powers from Baylor Scott White is with us tonight to talk about a potential new treatment. We're going to start with the results of a new study that he participated in. First, I want to just thank you for being here and talking about this. What was this study, and what did you observe about it?
Well, first of all, thanks so much for inviting us here. We love to get the word out about the study.
Sure.
So this was a collaboration between us at Baylor University Medical Center, which is part of Baylor Scott White Research Institute, and our colleagues at Texas Biomedical Device Center at University of Texas at Dallas. And they developed this tiny little device.
So small.
So small, and it's miniaturized from what used to go into clavicles, and it's a large stimulator. This is all that's implanted.
Wow.
So we implanted this in a first in human trial, open label safety trial, with 9 participants, and we saw 0 serious device related adverse events. Nobody needed it explanted or asked for it to be explanted, and everybody completed the trial. So it was tolerable. No one had to quit because it was too difficult. And then looking at PTSD symptoms, we saw 100% response rate. Even though the goal was safety, we did see 100% response rate and 100% remission rate where everybody lost their diagnosis. And finally, no one dropped out of the study, which is unusual.
That's wow. That's wow. That's like the perfect study. That's like the way you want these studies to go.
Yeah, and they asked me when it was over, is this usual for PTSD studies? And I said no.
Yeah.
You know, usual is 85% response rate, 40% loss of diagnosis, and maybe a 20 to 40% dropout rate. So yeah, much better results than we usually see.
And you think the biggest component of it being different and successful was this device?
Well, that's what we're proposing. That's what we're thinking.
Yeah.
It's much better, but we won't know until we finish this second trial that we just started, that is a sham-controlled or placebo-controlled trial where we randomize people, half of them get active stimulation along with the psychological therapy and half get sham. Although at the end, after we assess them, everybody gets another set of sessions, but with the active stimulation.
I want to ask if you could explain the connection between the study and what you're studying about PTSD and the vagus nerve and how it's all connected together.
Sure. So the vagus nerve is the 10th cranial nerve. Vagus, the Latin means wandering. So it actually starts in the brainstem, goes through the neck, and then innervates a lot of different organs in the body, including the heart, the lungs, the digestive tract. It's all part of the parasympathetic nervous system, which is really the rest and digest, feeding, relaxation. When we insert this here, the signal going up to the brain increases brain plasticity, and the rest of it helps you relax and makes it more tolerable at the same time. It used to be we had to choose. We either could help efficacy or we could help tolerability, but not both. So making it more tolerable, people could take benzodiazepines, Xanax, things like that, but that interferes with the learning.
Sure.
Or they could take a stimulant or other arousing measures to remember it better, but that can be more aversive as well. And this, we think, may do both without making you more anxious, and in fact making you be able to tolerate the treatment even better.
And something that just caught my attention, just the vagus nerve, PTSD, most of the time that condition is tied to something emotional, right? A vagus nerve, you just said it, it's connected to our parasympathetic nervous system, which helps us determine whether we're in fight or flight. It helps us regulate our nervous system all around. What do you think we should know about the people that are dealing with PTSD and how this could help them?
Sure. So the way that it tends to help is we know that it helps, especially if there's a deficit in learning of some sort. So we've used this with spinal cord injury, with stroke, where there's also some kind of damage in a rehab process. We can then rewire those circuits better with the VNS. Same thing in PTSD. We think that this will rewire circuits at a much faster rate.
And how many people would you say are being impacted by PTSD on a daily basis?
So first, we define trauma a little differently. You mentioned their emotional traumas, lots of traumas that people have.
Sure.
But for PTSD, the ones that result in PTSD are going to be exposure to actual or threatened death, serious bodily injury, or sexual violence. And most Americans will have one of those, unfortunately. Over 90% of Americans will have one of those traumas. And about 7% of Americans at some point in their life will meet criteria for PTSD from one of those traumas.
Wow.
So it's a large number of people, somewhere between 7 and 9%. On a typical year, it might be about 5%. And women are about twice as likely as males to suffer from PTSD.
So this device, the potential of the outcome of the second study that you're working on could really help the many people who are dealing with this.
Yeah, we might have an answer for people who don't respond to conventional therapy, even the best that we have.
Sure.
A lot of people don't respond, and this may hopefully help that.
Well, we hope so, and we'll follow up to find out. Dr.
Absolutely.
Mark Powers, thank you
you
so much for being with us. Remember, you can watch all of our Eye on Health segments right now on our CBS News Texas YouTube channel anytime you like.